Moving on to our next guest lecture, which is the conflict of interest in medical profession. And may I now invite our chairs, Professor Namal Vijayasinghe and Dr. Udayangani Ramadasa, to introduce our speaker. Thank you.
Good afternoon. I am Professor Namal Vijayasinghe and my co-chair is Dr. Udayangani Ramadasa. The next lecture is on conflict of interest in medical profession. The speaker is Professor Quazi Tarikul Islam from Bangladesh. Professor Islam is a professor of medicine at Popular Medical College, Dhaka, Bangladesh. Or do you, Prof. Islam?
Good afternoon, Honorable Chair of the session of SIMCON 2023. I'm Dr. Islam from Bangladesh. I'm Professor of Medicine. I will talk on conflict of interest in medical practice and profession. I'm sorry that I could not come in person, but I'm very happy that the authority permitted me to send a recorded talk. This topic is less addressed in different parts of the world. Especially in the Asian region, sometimes we see and feel that there are many issues of conflict in medical profession. For example, with patient, with doctor, with pharmaceuticals, with relatives, and also in researches. So there are many dimensions also with the organization, sometimes illegal, unethical, some other issues comes out. If we think about the conflict of interest in medicine, let us consider where we will consider a situation that there is conflict. Conflict of interest describes a situation in which a person is or appears to be at risk of affecting in a biased way because of personal interest. It's an absolute definition where one can understand that the breach can occur. Can occur in many different settings. Focuses on conflicts of interest in medicine that affect doctors in particular. But the most important duty of a doctor is to provide care that is the best interest of the patient. Conflict of interest everywhere in medicine occur when the interest of clinicians do not align with the interest of their patient. When systemic and institutionalized, such conflicts become particularly problematic. For example, create risks for individual patient and undermine the integrity of the medical profession. The conflictable situation in medical profession may conduct research studies. Through their research, they may help develop or invent new drugs or medical devices for their own interest. May invest a drug or biotechnology company, or sometimes a doctor or a hospital, a person is involved in his personal clinic, or sometimes the percentage they are taking for these activities. This is totally a conflictable issue. Doctors must not participate in, participant as a educational activist. But if they take money for that, if they take some sort of benefit from that, this is a conflict. Conflict of interest and ethical threats and their uh, resolution explain the conceptual framework of code of ethics. I can say another word that it is just paved with the code of ethics. Without code of ethics, you cannot get rid of the uh, situation of the conflict. So a framework is needed because it is impossible to define every situation where the threats of fundamental principles may occur or mitigating the action required. Normally, there is no conflict between professionals, internists, and interest of those they serve. So there should be balance between the patient welfare, and you should be very careful about your investment or you are thinking of you are making money from that. So it should be balanced. It should be unbiased, educational, and everything. If we think about the sources from where the conflict can develop, let us talk about the sources of conflict of interest: financial, professional, personal, and prejudicials. So think about the financial conflict of interest. Financial conflict of interest arises when the reimbursement of clinicians appears to encourage decision and actions that are unlikely to be the best interest of the individual patient. Very clear. So one should recognize and acknowledge and the very fastest step so that they can ameliorate the conflict of interest. The professional is very important. The influence of pharmaceuticals, medical device industry on clinician throughout the globe it is. But in Southeast Asian region, sometimes we see it is in a very bad manner, where through gift giving, support of continuing medical education, or guideline development, creates conflict of interest that may go unrecognized. So we can't take any help preparing a guideline from a pharmaceutical company. So professionally, you should be very sound and you should be very clear to your conscience. Personal conflict of interest, sometimes it is disagreement over a relative's care. You are hiring an unqualified relative or friend who is not suitable for the hospital service. So you did some mistake that you have taken the advantage. So this is the personal conflict of interest. Last but not the least, this is very important, that is the prejudicial conflict. Poor or rich doesn't matter. Whether the hospital consistently treat people who are wealthy, who are donor, differently than the general public, obviously the conflict of interest will arise. So hospital and medical profession should be unbiased and they must provide service to all the people in the same eye. So we think that the managing conflict of interest should be in the center point. It should not be biased one. I told before that the medical ethics is paved with the conflict of interest in medical profession. So there are four pillars in clinical ethics: autonomy, beneficence, non-maleficence, and justice. All these four pillars are very, very important for a doctor, for a profession to keep it uphold in such a way that one should not be involved in the conflict. So professional ethics is very important one. Let us see what is professional ethics. Professionals have ethical obligation because society entrusts them to provide essential goods and services that require adherence to a specific standard. But if they betray this trust, obviously the ethics is breached and this will develop a conflict again. Medical ethics, it is already implied Whenever we are taking the oath of Hippocrates after graduation and touching a patient for treatment, we take the medical ethics within ourselves. So, medical ethics concern issue related to practice in medicine. We cannot derive or deviate from this medical ethics. So, it is already implied. Bioethics is a part of medical ethics. Sometimes you will see in the movie, the first slide is disclosure. In this movie preparation, no animal is being harmed. It is also in medicine. Whenever you are using some drugs, you are giving some trial of research for the benefit of some medicine, and the patient is being used for the participation of your research, you must keep in mind, you explain the person that I am not doing an unethical job for a company, for a pharmaceutical, but the betterment of the humanity. Last but not the least, the clinical medical ethics, a practical and applied decision. And this aim to improve patient care and patient outcome by focusing on reaching a right and good decision in individual case. It focuses on the doctor-patient relationship. And it has got a long list of specific issues, of which, ladies and gentlemen, Mr. Chair, I must remind everybody here at Doctor, that the honesty, competence, integrity, and respect for persons are the main issues of this. Conflict of interest in patient care. Mr. Chair, we should remember that the primary object of the medical profession is to render the service for the humanity. Reward or financial gain is a subordinate consideration. Under no circumstances may physicians place their own financial interest above the welfare of their patient. And obviously, treatment or hospitalization is that is willfully if it is excessive and it is an unethical practice. Physician should not provide wasteful and unnecessary investigation. Sometimes they may do it. They sometimes give treatment which is rationally not required, may cause needless expense solely for the physician's financial benefit and for the benefit of the hospital or the organization where he is working or affiliated. This is totally conflict of interest of the patient care. And finally, the patient welfare takes the priority. We should remember this word in our patient care. So there should be balance between the profession and the ethics. And if it is not, the ethics go down. If the ethics goes down, there will be a conflict of interest. And this is today's our topic, that we cannot do this, we cannot breach the conflict, and we cannot breach the ethical consideration. Where are a doctor duties regarding conflict of interest? I must go very short, Mr. Chairman. Sometimes we forget, we don't care. So we develop our own conflict with the patient. We forget my responsibility as doctor, that whenever I perform something, if it is surgery, if it is something else, for example, in medicine, if you draw a pleural fluid from a patient, you take the informed consent from the patient. Patients sometimes can refuse. If the patient refuses, you must respect to the autonomy of the patient. So we should be very careful about the consent. What is informed consent? It has got two parts. You inform the patient risk and benefit of the patient's procedure you are going to do. And secondly, you should take the written consent from the patient, so that you should not be in a malpractice, or you should not be questioned in a lawsuit. One should be very careful regarding this. Whenever you are in a conflict of interest, please call a third party or a neutral party to mitigate the issue, and you should not conduct it by your own, and an investigation should be done by the third party. If a doctor provides less effective medication to a patient because of an agreement with the pharmaceutical company, this will be judged by the third party. Very interesting, in 2020, in the United States, 2010, I'm sorry, it has been, there was a survey, and the archive shows that 72.2% of the doctors, they want or they love to have industry-sponsored lunch during any conference, and it is appropriate. There is no problem. So sometimes it is very difficult. Physicians are doing this willingly, or they are taking the free sample from the pharmaceutical, collaborate with the medical device manufacturer. These are the things. Sometimes they are taking the travel expense from the pharmaceuticals. These are all under the conflict of interest. A doctor not do, because even a small gift produce in their recipient a disproportionately powerful willingness to reciprocate in some manner. Ladies and gentlemen, just these lines are very important. A simple, small gift can influence you. So we should avoid this situation. I'm at the end of my lecture, and this is the last few slides where the research ethics and conflict of interest. As we know that the interests of medical scientists are particularly complex, since they are justified by moral and physical welfare of their research subject, while the reputation and incomes of scientists depends on the success of their science. Conflict of interest may unwittingly lead to manipulation of research. Subject and their lay representative on research committee, it is equally important to recognize distinction between legal and moral aspect of conflict of interest. So what to do when conflict of interest arise, or I'm thinking that it might. So it is better to avoid or better to disclose. You will see in a presentation sometimes the person who is giving the lecture, in the first slide, he's telling, I don't have any conflict of interest in this talk, if it is something research or something like that. Or you can recuse. It is better to avoid this situation when you feel that there are some conflict. So, ladies and gentlemen, do not reasonably appear to bias professional judgment, enhance one's professional knowledge and skills, and do not diminish the dignity or autonomy of the professions. Before I conclude, I will tell a very small case. A woman entered the emergency room with abdominal pain. She undergoes a CT scan and diagnosed with an abdominal aortic aneurysm. The physician informed her that the only way to fix the problem is surgical, and that the chances of survival is 50-50. They also inform her that the time of the essence and the aneurysm can burst. She would die in a few short of minutes. The woman, an exotic dancer, fears surgery because there will be a scar on the abdomen, and she refuses. Believing she is not in the right state of mind, and with urgency, the surgeon performed the procedure without consent. She survives, but after recovery, she sues the hospital for millions. So the last slide is my question for the audience, do you believe that the physician's actions can be justified in any way? The second question, is there anything else that they could have been done, or is it ever right to take away someone's autonomy? And finally, what would you do if you were on the healthcare workers in the same situation? Thank you very much, Mr. Chair, and thanks audience for your patience sharing. Thank you very much.
So, on behalf of Sri Lanka College of Internal Medicine, I would like to give our heartiest appreciation to Professor Islam for sending this very informative recorded lecture on this complex topic of conflict of interest in medical profession. So, as a symbolic handing over, I would like to give our appreciation to Professor Islam with this. Yeah.
Thank you very much, everyone. And now